But I did just briefly want to thank you all for this opportunity. I think we all are thinking in very different ways. I can't believe how much our mindset around this project and how to bring it forward has changed over the course of these couple weeks. So thank you so much for this. Just briefly want to introduce Mount Mary, who we are. We are a Hispanic serving institution. We are a minority serving institution. We are #1 for social justice in the Midwest, which means that we graduate the highest number of Pell eligible students into high earning careers. And this project we feel represents that, and also our team represents that, which is Monica. Please stand up and give a pose when I say your name. Monica Olage. We have Michelle Herrera Carmoda, Joe Zielinski, Alexis Outlaw, and Galilea Garcia Gonzalez, and Bob Schwartz, our wonderful mentor.
Go Bob! We love Bob.
So our initial idea for the Culture Robot was born out of our experiences as healthcare providers, hearing from patients, having experiences where cultural miscommunications negatively impacted the care, and also from a health equity award from Amazon Web Services. The communities that we are serving are ever-changing. Healthcare technology is increasingly sometimes making care more accessible, but also can make care less personable as we make more accessibility. So we really wanted to expand our thoughts about who could potentially be our market, who could we partnership, and we went through our interviews. So we led with certain assumptions. We assumed that healthcare agencies were going to pay for this training and technology to engage in effective, culturally aware care. We assumed that providers would want an efficient way to be more culturally aware when interacting with their patients. We thought that healthcare providers would want to use a tool, and that AI is so ubiquitous in our technology that if we built a tool, that people would just want to use that tool. And so we sought a number of stories. We had a lot of success with talking to our end users and our beneficiaries of these products. So healthcare providers, healthcare educators and trainers and patients were all really excited to talk to us and say, yes, this is a problem. Like, we want to talk about this, and we're curious how your product could help. Where we ran into a bit of difficulty with getting access to interviews was folks in administration, folks in interpretive services, who were more responsible for the problem. We got some, why do we want to talk to you about that problem quite yet? So we need to get a bit more data before those folks will want to talk to us. And so we sought some stories, and what we're finding is that healthcare providers are saying that it's all about efficiency. Productivity is so important in what I do. I keep hearing about productivity, and I'm worried that this is not going to be efficient. But then we talked to patients about the problem, and they said, well, when we're not engaging in these culturally aware conversations, that is actually making my healthcare less efficient. Mm-hmm. So our insight from that was that while there is this big push and big concern with efficiency, our patients are telling us that this is actually going to be inefficient to not be engaging in this way. So there needs to be a bit of education about the patient perspective to our healthcare providers and to our healthcare administrators. Thank you. We found that both patients and healthcare providers wanted to have the conversations about cultural care, but that the onus was on the patient if the healthcare provider did not have the skill or the tool to be able to have that conversation. So a chatbot provides a way to ask questions without that fear or risk of offending the patient if the provider doesn't have that skill yet. It's a great way to build this skill. We also found that there's a lack in the current type of training that folks are receiving, that a lot of training was a one and done. You watch the video, you check the box, we did your training, or it was reactive. We had this incident, and we want to make sure that this incident doesn't happen again. But we currently don't have a lot of immersive ongoing trainings or in-the-moment training that can occur. So we found that there was a need for this evidence-based informed curriculum design using this type of immersive technology. We did a bit of market exploration as well, looking at those threats that are out there, and we did find that some of the big publishers do have tools, but the current tools are either not evidence-based, we can't go a bit deeper, or there is not, in the evidence-based AI, there is not an opportunity for that immersive training. Oh, thank you. So next up, we are happy to share that we have a potential partner that we are working with to partner with a clinic to give us that data that our other more funding partners are interested in. We need to keep following the money and completing more interviews. We are going to explore what we had was that insight of, there's a lot of AI out there, but there's not a lot of education about ethical use of AI in the healthcare market. We're going to consult our legal teams, we're going to apply for some additional Amazon funding, and we're going to apply for the National I-Corps program to continue our customer discovery. Thank you.
Woo-wee! Ow, ow, ow!